And as for the latest COVID-19 totals here locally, Kern Public Health reporting 380 more infections today, but no new deaths. The total number of victims to the virus in Kern remains at 2,427. Well, as the summer months are approaching, there has been a sudden increase in the number of reported COVID-19 cases here in Kern County. 23 ABC's Brianna Polk spoke with a local doctor in the public health department today and shares an in-depth look at what health professionals are foreseeing in the coming months. Brianna.
That's right, Brianna. Well, according to Kern Public Health, on May 8th, 40 COVID-19 cases were reported here in Kern County. And just 2 days later, the count spiked up to 150, which is why local health experts want to inform our community about a potential summer surge.
COVID has not acted like typical viruses in the past, like the flu in the wintertime, it goes up, in the summer it just peters out. So it is definitely conceivable with everyone out and about now that we could have a little bit of a surge.
Gary Church, COO for Memorial Hospital, says that Omicron is still the predominant variant of the virus, which is a part of the reason why an influx is taking place. Michelle Corson from Public Health adds that as they monitor the ever-changing case numbers, they also use the California COVID assessment tool to plan and prepare for the coming season.
The modeling is saying that we will continue to see some increases. In fact, we really look at those hospitalizations, and the modeling is predicting that we will see, in fact, a high of 65 hospitalized COVID patients peaking on July the 7th. And we will also continue to see some increases in our cases in Kern, that peaking on June 25th.
The CDC says that some people who have been infected with the coronavirus can experience long-term effects from their infection, known as post-COVID conditions or long COVID. Church adds that if you feel any COVID-19 related symptoms after 6 months to a year, it is important to get tested to determine if you are reinfected with the virus or are experiencing post-COVID conditions.
You feel good one day, you feel weak the next day. You may feel shortness of breath when you've never, even had shortness of breath. So it is kind of a weird thing.
The CDC says that people who are not vaccinated against COVID-19 and become infected may also be at a higher risk of developing post-COVID conditions. Church adds that the symptoms you feel may come and go.
You will definitely feel like you did probably the first time. You feel like you've got the flu, you're achy, you've got a temperature. That is really indicative of a reinfection.
And for more information regarding post-COVID conditions and how to continue to keep you and your loved ones safe, you can visit our website, turnto23.com. In studio, I'm Brianna Polk, 23 ABC News, connecting you.